Thank you, Mr. Williams, and a pleasant good afternoon to everyone. This afternoon, I'll share with you the HEOC situation report for July the 14th, 2021. We have been responding to and trying to control this second wave of COVID-19 cases for exactly 8 weeks. So today, Wednesday, July the 14th, makes 8 weeks since we've been responding to this outbreak. Within this time period, we've added a total of 499 cases. Let me pause and share that today we identified 4 additional cases of COVID-19. So within the 8-week period, we've added 499 cases to the Federation's COVID-19 tally. We have a total of 390 recoveries within this 8-week period. And again, within this 8-week period, we have a total of 106 active cases remaining. Now, also within this 8-week period, we've had a total of 31 admissions to the COVID-19 ward at the JNF General Hospital. So over this period, between May 19th to July 14th, 31 patients were admitted to the COVID ward at the JNF General Hospital. But it's important to note that as we speak, the COVID-19 ward at JNF General Hospital is void of patients. So at present, we do not have any admissions. And over this period, we have reported 3 COVID-19 related deaths. This map just shows the distribution of the COVID-19 cases between May 19th up to June the 30th. And this shows that the COVID-19 cases are occurring mainly in the areas that are densely populated, St. George, along the East Coast to Christchurch. And then the next map shows the distribution of the COVID-19 cases up to today, July the 14th. And again, the COVID-19 cases are occurring in the parishes that are densely populated. This slide shows the epi curve for the present wave over this past 8 weeks. And you can see that the daily case count peaked between June the 11th to the 23rd. And the curve is on a downward trend. And the graph down the bottom just highlights the number or the daily count over the past week. Okay, so as I said before, we just got data coming in from the laboratory, and today we identified 4 additional cases of COVID-19, so that brings our total federation-wise to 544. So we have a total of 544 confirmed cases of COVID-19, St. Kitts 526, Nevis 18. We have 435 cases fully recovered, and this is since we've been responding to the pandemic from last year to present. We now have 106 active cases. It's important to note that the number of active cases have fallen drastically from over 300. We are now down to 106. And as I said before, we have 0 persons admitted at the JNF General Hospital, the COVID ward. So we do not have any admissions on the COVID ward as we speak. And as I said before, 3 COVID-19 related deaths. Just an overview as to the situation in the prison system. Now, we have identified a total of 55 inmates who've been impacted by COVID-19. 44 of these 55 have recovered, and so we monitoring 11 active cases. In terms of the staff, 15 staff members have been impacted by the disease, 3 have since recovered, and we have 12 active cases amongst the staff members. Now, it's important to note that the Ministry of Health facilitated a sensitization session for all the staff members at the working within the prison system, and this session was conducted last Friday, July the 9th. So they covered infection prevention and control in the context of COVID-19, and so that's important, and so that's going to improve the efficiency within which they are monitoring the inmates that are isolated in the system. Okay, so as at end of work day yesterday, Tuesday, July 13th, we administered a total of 42,250 doses of the AstraZeneca Oxford vaccine. So that gives us a coverage of 70% in terms of the target population covered with the first dose, and a coverage of 57.9% covered with the second dose or fully vaccinated. So more specifically, 19,119 individuals are fully vaccinated. Now, data coming in from this afternoon tells us that 70.2% of the target population is covered with the first dose, and 58% of the target population fully vaccinated, receiving 2 doses. Now, we've been getting a number of questions in terms of persons seeking clarification regarding the 70.2% coverage, 70.2% of the target population covered with the first dose. Next slide. Okay, so let me just pause and explain. The target population for the Federation of St. Kitts and Nevis refers to the adults within our population. And based on the last census conducted in 2011, it's approximately 33,037 individuals. Now, the adults comprise 70% of the total population. And so the first dose of the AstraZeneca Oxford vaccine have been administered to 23,180 individuals, or just over 49% of the total population. The second dose, in terms of the amount of persons or adults who are fully vaccinated, comes up to 19,065, a little over 40.5% of the total population. So in other words, we still have a remaining 9,900 plus individuals or adults to be vaccinated. So let's say 10,000. We still have approximately 10,000 adults yet to come on board in terms of accepting the vaccine. So in other words, we've achieved 70% of the target population. We still have the remaining 30% of the adults in our population in terms of having them, being empowered about the vaccine and coming on board and accepting the vaccine. And I also want to underscore that this data is based on the last census that was conducted in 2011. And so we are now in 2021, and so by extrapolation, I'm sure the actual number of individuals remaining would be a little bit more than the 10,000. So this is just, these figures are like proxy figures to the real numbers. Again, this just underscores, and this just serves to remind you that in our population we have the Lambda variant in circulation. So far, we gather that it's more transmissible than the original variant that was in circulation last year. The scientists are still conducting studies with regards to this variant in terms of its virulence and its response to the various vaccines on the market. The contact tracing process continues, and our team of public health practitioners, we've already interviewed and engaged over 2,543 individuals who were placed in self-quarantine, and over 2,200 of these individuals have already been released from quarantine, and at present we have a remainder of about 262 individuals still in self-quarantine, and this is in keeping with the drastic reduction in the number of active cases. We continue testing the cases, we continue testing the contacts of the cases, we continue conducting targeted and random testing with well over or almost 13,000 samples being processed within this past 8-week period. Now, I just wanted to pause and just reiterate or provide some additional information regarding the recent policy change with respect to fully vaccinated inbound passengers. So fully vaccinated inbound passengers who landed on the Federation this week, Monday, July the 12th, or yesterday, or even today, this afternoon, July the 14th, and beyond, such individuals will qualify for a reduction in their quarantine period. Now, this quarantine period is now stipulated as 3 full days, and then the exit test sample, the exit nasopharyngeal swab, will be taken on the morning of day 4, and that sample will be sent to the lab for processing. And so the individuals will be released, officially released from quarantine after a negative RT-PCR test result is received from the lab at the end of day 4. So usually the results come in the evening, the night of day 4. And now this policy change became effective on July the 12th. And so it applies to individuals who landed on July 12th or beyond. And so individuals who came into the country up until July the 11th, midnight, it means you landed under the original health and travel protocols. And so the terms and conditions of your quarantine period is as stipulated in the previous iteration of the health and travel protocols. Now, we've been opened for 3 days now since the lockdown, and so what's the way forward? Well, the way forward involves us living with COVID. And this is a quote that I found in the Wall Street Journal article dated July the 11th. It was Edward Steinham who said, and I quote, "This is a virus that we are going to have to learn to live with, and we are going to have to learn to manage, and we are going to have COVID-19 patients for the foreseeable future." And so our daily case counts are in the single digits as we speak. So today we've added 4 positive cases, and so that's good. And so there are individuals who are of the impression that we are going to be COVID-free again, probably in another week or 2. So no, that's not going to be possible. We are going to continue having or identifying newly diagnosed COVID-19 patients on a daily basis, on a weekly basis, for the next couple of months at least. And so we need to understand that COVID is here and that we need to live with COVID. So how can we exist and live with COVID? How can we live and yet protect ourselves from the virus. And so this is what living with COVID really means. And so living with COVID means wearing your face mask at all times, sanitizing your hands or maintaining good or adequate hand hygiene, maintaining a safe distance of 6 feet or more from others, and boosting your own immune system. These steps, these protective measures are very, very important. All right, because you do not know where the virus is. You do not know who is infected. It could be loved ones, it could be friends. And so these protective measures are simple ways in which you can protect yourself and your loved ones from the virus. Living with COVID means coming on board and accepting the vaccine if you have not already done so, because it's proven to be a very effective protective measure. Living with COVID means that if you are experiencing COVID-like symptoms, it's important, it's an imperative that you remain at home, seek testing and medical care at the soonest. If you are diagnosed with COVID-19, you will automatically be placed in isolation, either at home or at a facility. And you are expected to remain in the confines of that space for the duration of the isolation order. It's your responsibility to limit the exposure of others to the virus. If you are a contact of an individual who is diagnosed with COVID, you will be asked to quarantine at home or go into self-quarantine. Again, you're expected to remain in the confines of your home for that stipulated period. And if you have COVID, or if you are a contact of a case, and if you're in isolation or self-quarantine, you're expected to adopt the protective measures I just explained in terms of wearing your face mask when interacting with your care provider or the individual providing you meals, etc. You have to maintain adequate hand hygiene and maintain a distance away from your loved ones who may be providing you care during the period of isolation or quarantine. These simple guidelines will help prevent the third wave of infections and prevent another lockdown. We have a personal and social responsibility to adopt these protective behaviors. Let us work together to maintain the health and well-being of our people. I want to just pause again and just share some information regarding the 311 hotline operations. Now, the 311 hotline service was established to facilitate accessibility to reliable information regarding COVID-19. So the hotline serves the general population. So if you are confused about any of the issues related to COVID, if you are in need of medical care or emergency public health services, feel free to call 311. What are the responsibilities of the 311 operators? They are meant to assist nationals and residents who are experiencing respiratory tract symptoms and help guide them and link them with care and testing. They are meant to address callers with issues pertaining to individuals in quarantine and isolation. So if you have any questions, you can call regarding quarantine or isolation or even testing. You can address questions related to the general health system operations during the pandemic. For example, the opening hours of the health centers, special clinics, and scheduling of appointments. If you want to document side effects of the Oxford AstraZeneca vaccine, you can call the 311 operator. They are meant to refer callers who may have psychosocial needs or concerns to the appropriate services provided. So in other words, the 311 operator can link those in need of psychosocial support to the counselors. Please note that the 311 operators, they do not provide COVID-19 test results. I repeat, the 311 operators do not provide COVID-19 test results. They are meant to link callers to allied support officials for assistance. For example, they can link you to the port health surveillance technicians, including updating callers on travel protocols. They can link you with the police for curfew clearance, and social services, Department of Social Services for care packages and financial assistance packages. So that provides a summary of the roles and responsibilities of the 311 operators. Thank you.